Well, as I indicated at the head of the program, we are at Bumrungrad Hospital. Now, they have every possible medical facility available, not only for people in Thailand, but for people around the world who come here to have the medical services. Because why? Quality of doctors, quality of the hospital, and now a brand new women's centre. What does that all mean? Well, we thought we'd take the opportunity to speak to the Senior Director of Hospital Marketing, Mr. Kenneth Mays.
Hi, Valerie.
Good to have you back. Thanks for joining us. Now, you had a women's centre before.
Right.
Other hospitals in Thailand have women's centres. What is so different, and why the pizzazz about this particular centre?
Well, we like our environment to be a very pleasing environment. We know that actually contributes to patients feeling better. One of the things was just capacity. We have the capacity for about 200 women a day at the Old Women's Center, and it could feel really full sometimes. This center has a capacity of 300 women a day, so we're never going to feel full. We'll always feel very comfortable. As you can see, the surroundings are quite a bit more comfortable.
Very
and so
modern.
forth. And we've hired some additional doctors too. We had 50 doctors, and now we have 62 women's specialists, OBGYNs, but OBGYNs that also have subspecialties in areas like GYN oncology or laparoscopic surgery or menstruation and so forth. So a woman, no matter the stage of her life, is going to find a doctor here that really has the specialty that's necessary and the equipment and the technology necessary to help her.
As far as the doctors are concerned and their qualifications, I'd like to just remind our viewers overseas that many of the Thai doctors that are here have had education overseas and then they come back here. So these specialities and being up with the latest trends is something that your hospital always promotes.
Yeah, and we're fortunate. I think the best doctors in Thailand really like to work at Bumrungrad. We're a place that has very, very high doctor satisfaction levels. And so we really kind of get the pick of the crop, both from doctors that are the top doctors here in Thailand and Thai doctors who are coming back from education overseas.
Dr. Jamari, the actual unit now has 7 individual sections and you've got 62 doctors working together. That was obviously your biggest challenge, but what are those units? How do they work?
With the new OBGYN center or this new women's center, we try to emphasize on have the doctors as a patient's advocate. Right? So we will have a group of general OBGYN doctors who patients can come and see the doctor with whichever or whatever problem they have. And then after the doctors treat them, taking care of them, and get into certain level of problem, then they will refer the patients to higher level or more specialized. So then the patients themselves can know the limit of the doctors, but as well they can go to further higher standard of care. But then in the past, when we have the old center, each doctor seemed to work as an individual solo practice. But to introduce this concept, it means that not a fragmentation of the treatment. The patients can have the holistic approach and also specialized backup in the way the center will do. So instead of a solo, we will have the general OBGYN, and then if the patient has further problem in menopausal problem, they will go to see a specialist. But the OBGYN general one will still follow the patient with the specialist instead of let the patients go to specialist and forget everything. And then when the patients come back to the OBGYN general one, and then the patient may got problem with others, just like a gynecologic oncology problem, they will go to the specialist. So this kind of concept is start to establish, and we also start to have the practice guideline. So every group knows what they should do, what they shouldn't, and then the patient also need to have more information of what this kind of concept will be in the future.
Right. And finally, are there any new services that you're bringing, that with the new technology that you're able to use here, you always seem to have the latest technology. Is there another area within the medical care unit that you're actually introducing for the first time into the Women's Centre?
We actually explore the technology in terms of gynecologic oncology treatment, right? So right now for gynecology treatment, you come to do the physical checkup, you found the problem, and then you treat it, right? That's it. But in the future, technology in terms of not laparoscopy, the laboratory, you can do actually predict more in terms of genetic prediction. So right now we actually expand our ancillary service in terms of set up more on the genetic lab screening. Okay, so the patient can actually know in advance what they should do or what they should be prepared. Okay, that's the beginning. And at the end of the treatment, not only the chemotherapy, surgery, laparoscopic. Okay, right now I think in the trend of technology, more and more minimal invasive technique has come. So that's the technology that we try to explore. Yes.
And what is your hospital's position about, this is always a question for Asia, isn't it, and particularly for Thailand, I suppose, is natural birth something that you're really trying to talk the Thai women particularly into achieving rather than other means?
I think that's how the patients will give birth is something that's a challenge for the private, right? Because for the Thai, they love to say, okay, I want to have my baby at this
that day.
time. Yes, not daytime, right? So we have a very high cesarean section percentage. But because I think we agree that a natural birth, it's the way it should be. So that's why one of the specialties that we develop is natural childbirth.
I'm very pleased to hear that because, as you know, around the world people think that we don't have natural birth here. Indeed we do. And Bumrungrad can offer that and many more services at the Women's Centre. Dr. Chamari, thank you very much for joining us.
Thank you. ขอบคุณค่ะ